Welcome. My name is Dafna Lender. I am an expert in attachment focused therapy and in family therapy. And I'd like to talk to you today about the concept of working with adult clients who are also parents and actively inviting these adult clients who may not have come into therapy to work on their relationship with their child specifically, that you propose working with their relationship with their child as a way of helping them to heal the trauma of their own childhood. I find this to be pretty intuitive and common sense, that there's this feeling or this sense that when clients come in, whatever their presenting problems are, whether they're having problems with depression or anxiety or self-esteem, relationship problems with their spouse or at work or drug addiction or addiction to other substances, when you're doing an intake, you often review and talk about their relationship with their own parents when they were children and how they were raised in order to assess the level of the relational trauma that they experienced. Typically, these many clients have attachment issues, trauma issues that they experienced when they were young in their own childhood. And we know that we replay aspects of our own traumatic experiences when we were children onto our relationships with our intimate partners in the family, whether it is a spouse or whether it is our children. And that there's also a really hopeful piece to that, which I've found in my clinical experience, and probably yours too, is that if you improve your current relationship with your child, you are able to go back in time and have a reparative experience with your own childhood self, as if you're able to reparent yourself, and it improves the felt sense of how lonely you might have been as a child or how reactive you are to those childhood wounds through parenting your own child differently in the here and now. By working on our relationship with our child, we're reconstructing or recreating a more positive feeling about how we are able to regard ourselves in our childhood. And the symptoms of feeling shame, feeling loneliness, feeling like there's something wrong with me goes down, gets smaller. If we're able to parent our child differently, it's a reparative process that's intergenerational. And so what I want to share with you is the idea that my work has been primarily working with parents and children together in family therapy and focusing on the child's needs and on the attachment relationship. But then I started working with adult clients that would come to me for a number of reasons that weren't related to their children at all. It was people who were adult clients. They came because they had, as I said, depression, anxiety, self-esteem, drug addiction, or substance addiction. And they also happened to be parents. They may be parents of younger children who are minors under the age of 18. They might be people who are parents of adult children. And when I did the intake, I would be sensitive to how is your current symptomology, your problems that you're bringing into therapy, how do they also apply to your relationship with your child? And many people hadn't even really thought of that. They didn't necessarily come to work on their relationship with their child. But what I have been able to understand is how powerful it is to be able to take a symptom that you might be having, like low self-esteem, and see how is it affecting your relationship with your child, and how you might be able to work on your relationship with your child as a way of helping yourself to resolve your own problems. So let me give you an example. First of all, many of your clients are adults. They're coming for individual therapy, and they're not coming specifically to talk about parenting issues. They're just coming to talk about problems with work, problems with in their romantic life, symptoms of depression or anxiety, etc. Okay. We know from research that there's a phenomenon that is intergenerational trauma, where relational patterns that are traumatic in infancy and childhood are passed on non-consciously to the next generation. So in this workshop, what I'm suggesting is, if it's clinically appropriate, you yourself as a therapist can actively propose working with your adult client on their relationship with their child as a way, as a channel, as an active avenue for being able to make themselves feel better about themselves as humans. That's the premise of this workshop. As a therapist, you might be able to propose, hey, are you interested in working on your issues through looking at the relationship with your child with currently, and seeing how you might relate to your child differently. And then we will take a look at how that impacts your self-esteem, your symptoms of depression, since our premise is that you would have liked to be treated in a different way in your childhood, and you weren't, you didn't get the kind of parenting that you needed. How can you have a healing relationship with your child, and how does that affect you and your perception of yourself as a child? So it's kind of going forward to go back, and going forward again, and then going back. And I found this to be just a really neat process and very powerful. So I'd like to share that with you. So the first thing, though, I'd like to just talk about this premise of intergenerational trauma in this next segment.